Welcome to the Infection Prevention Sustainability webinar series for long-term care clinical and non-clinical settings. Session 1 is focused on the top clinical citations in long-term care clinical settings. My name is Jean Lyon. I work for Comagine Health, and I am a Senior Infection Prevention Advisor. And what we know is that for the past several years, nursing homes have been cited by state and federal surveyors for having issues with infection prevention programs. Even before the SARS-CoV-2 pandemic, infection prevention and control citations comprised the highest number of deficiencies in nursing homes. The basic premise of the education program is to develop skilled staff in infection prevention so that they will become part of the facilities team to maintain a safe environment for residents and staff, and at the same time be in a constant state of survey readiness. There are 6 learning objectives for today's presentation. We're going to discuss the infection prevention FTAGs, including the new FTAGs, and understand the importance of being in compliance with the regulations. We're also going to talk about how to develop a complete infection prevention and control program, including incorporating an antimicrobial stewardship program. Identify through observation a minimum of 8 circumstances that would be cited for non-compliance with infection prevention and control practices in clinical areas. We're going to conduct environmental rounds using knowledge gained to correct observed deficiencies in your own buildings. We're going to identify the most common infection control citations prior to COVID, and then again, the most common cited during the pandemic. Using the content of the webinar, we're going to train the staff on circumstances that could be cited for noncompliance in infection prevention and control in clinical areas. Now we will pause the presentation to allow the facilitator time to administer the pretest questions. There are 8 FTAGs pertaining to infection prevention and control. Each one has the potential to be out of compliance and cited during a survey. We will discuss each one briefly and discuss the first 3, F880, 881, and 882 in detail, as these comprise the foundation of a solid infection prevention and control program. The last 4 FTAGs, F884, 885, 886, and 887 will be defined but not discussed in detail during the presentation. These last 4 FTAGs were created as a result of the SARS-CoV-2 pandemic. F880 is the foundation of the infection prevention and control program. It needs to be a written document that is detailed and comprehensive. An antibiotic stewardship program needs to be part of the infection prevention and control program. We will discuss this standard in detail today. F882 refers to the infection preventionist qualifications and role and will also be discussed in more detail today. F883 requires the facility to offer influenza and pneumococcal vaccinations to residents. There needs to be a process in place of when the vaccines are offered, and in the case of the influenza vaccine, the month when the vaccinations will begin. Policies and procedures need to be in place that describe the process. Documentation of vaccinations given, risks, and potential side effects must also be documented. F884 requires every nursing home to report data to the National Healthcare Safety Network, NHSN. Each nursing home should have at least 2 staff members who have access to the system for data entry. COVID vaccinations of residents and staff are required to be entered into NHSN weekly to avoid penalties. A policy and procedure is needed to outline the process that is followed to report COVID-19 outbreaks in the nursing home. Documentation of contact with residents, representatives, and families is essential to avoid a citation. There are also new changes coming in the fall of 2021 that will require additional documentation into the NHSN software. You must know when testing is to be conducted in your facility. There are more asymptomatic cases of COVID-19 being reported in vaccinated residents and staff members. County positivity rates in the local health jurisdictions determine testing frequency. Education of residents and staff about COVID-19 vaccinations is required, and the vaccine must be offered to residents and staff. Provision of education must be documented. You need to obtain a copy of the State Operations Manual Appendix PP Guidance to Surveyors for Long-Term Care Facilities for a full explanation of the requirements. You also need to know that FTAGs 884, 885, 886, and 887 are not in the State Operations Manual Appendix PP at this time, but they can all still be scored if there's a deficiency in these areas. It is important to know the standards and the expectations, even though it's not recorded in the State Operations Manual, in order to avoid citations during a survey. A risk assessment, policies and procedures, and an antibiotic stewardship program are all part of the infection prevention and control program. F880 is the foundation of the infection prevention activities in the nursing facility. You must assess your environmental risks, have your policies and procedures in place, a system for recording incidents identified under the Infection Prevention and Control Program, and the corrective actions that you have taken. Examples include how to store, process, and transport linens to prevent the spread of infection. A review of the Infection Prevention and Control Program provides direction for the focus of the program for the following year. Always identify the who, when, and what is needed to complete the annual review, and then document the review with suggestions for the coming year's focus and surveillance. Consider walking environmental rounds with representatives from a variety of departments such as maintenance, environmental services, nursing, dietary, and leadership, and then ensure that there is an antibiotic stewardship program in place that is a component of the Infection Prevention and Control Program. You need to have as many policies and procedures as necessary to cover all aspects of infection prevention activities. Just a few examples include how to handle, store, process, and transport linens, standard precautions, types of isolation, hand hygiene, food handling, and surveillance plan and process. The most common FTAG citations in the years prior to the COVID-19 pandemic included poor hand hygiene, improper handling of linen, improper cleaning of equipment, lack of proper infection prevention measures, and a poorly developed infection prevention and control program. The most common FTAG citations during the COVID-19 pandemic in 2020 included improper use or no use of personal protective equipment, failure to practice good hand hygiene and hand washing, improper sanitation of equipment, staff who were allowed to work when they were known to be COVID positive, staff and residents not wearing masks, and residents eating meals together when this was not recommended. It is everyone's responsibility to identify opportunities to improve the environment and reduce the risk of hazards. Let's look at a few examples and see if you can identify opportunities for improvement. Take a few minutes and look at each photo and identify with your surveyor eyes what the problem is. Your facilitator will pause the presentation at each photo. This will allow you time to look at the slide and share your thoughts on the issue that would lead to a citation. In this particular photograph, damage has been done to the sheetrock. This will make terminal cleaning of the bathroom walls incomplete. In this photo, you see a dirty cup and a bowl are in the patient's bathroom sink. The trash can is full of paper towels and needs to be emptied. There is also a paper towel underneath the sink on the floor. Take a few minutes and look at this situation. Boxes of papers are all placed on the floor. This creates a fire hazard. There could also be a HIPAA violation if personal health information is located in the boxes. In this photo, there's a towel that was placed under the washing machine to soak up water. This is a risk for bacterial and fungal growth. The floor is unfinished, with the tile not extending under the machines. This makes the floor unable to be properly cleaned. Where are the gloves? And when the gloves are put in the box, what size will they be? One size does not fit all hands. Only equipment that is being used can be in the hallway. An example is an isolation cart or a medication cart in active use. Lifts that are not in use cannot be stored in the hallway. Door stops are never to be used in a healthcare setting. In the event of a fire, the door would not close automatically, and this would allow spread of the fire. Stained ceiling tiles indicate a leak in the pipes above the tiles. Also, one of the tiles is not correctly placed, and there is a gap. Good job! The more you look around your facility and train your eyes to see situations that can be corrected and are corrected quickly, the more survey-ready your facility will be. The goal of environmental rounds is to ensure that you are in a constant state of readiness for surveys and to provide a safe environment for your residents and your staff. Conduct regular rounds as an interdisciplinary team at least once a month. If major repairs are needed, they might need to be budgeted as a capital budget item. The Antibiotic Stewardship Program is part of the Infection Prevention and Control Program. The goal is to reduce the use of unnecessary antibiotics, track prescribing patterns by provider, and to ultimately reduce the risk of multi-drug resistant organisms. The purpose of the Antibiotic Stewardship Program is to avoid unnecessary antibiotic prescribing by the providers. Antibiotics are to be prescribed only as necessary for bacterial infections, and the correct antibiotic must be ordered for the correct period of time in the correct dose. Antibiotic overuse contributes to antibiotic resistance and to multi-drug resistant organisms. Take a moment and look at this slide. These are 6 of the 18 most alarming antibiotic-resistant threats that cost the U.S. more than $4.6 billion annually. All of these 6 microorganisms are antibiotic-resistant threats. An antibiogram is a great tool for the Antibiotic Stewardship Program, and it is required to be part of the Infection Prevention and Control Program. An antibiogram is a summary profile of antimicrobial susceptibilities of local bacterial isolates that have been submitted to the clinical microbiology laboratory used by the facility. Antibiograms are used to assess local susceptibility rates to assist in the selection of antibiotic therapy. Antibiotic resistance is trended over time within a facility for at least a year. And antibiogram susceptibility rates can be compared across institutions and used to track resistance trends. Data on antibiotic use should be collected and reported to the Infection Prevention Committee and to the Quality Committee. Many examples of antibiograms are available online, along with videos on how to report antibiotic usage and link antibiotic use to specific providers. It is ideal to have a software program that can track the antibiotic prescribing patterns and drug resistance. This toolkit is available from AHRQ and is a guide on how to do an antibiotic stewardship program. F882 refers to the infection preventionist qualifications and role. This has been required by CMS since November of 2019. It is also a critical component to the success of the Infection Prevention and Control Program. An IP must be identified, work at least part-time for the facility, and have the education and experience to do the job. CDC offers infection prevention education opportunities. The long-term care program is designed for nursing homes, but it covers all of the basics. The course is made up of 23 modules and submodules that can be completed in any order and over multiple sessions. It's free and offers continuing education including CME, CNE, and CEUs. To earn continuing education, register for the course and complete all modules, the post-course evaluation, and the examination. A second education opportunity is STRIVE, States Targeting Reduction in Infections via Engagement. This has been developed by national infection prevention experts, and the courses address both the technical and foundational elements of healthcare-associated infection prevention. And individual modules can be used for new employee training, annual infection prevention training, and also for periodic training. Access to IP professionals and resources for a nominal fee can be one of your best investments. Experts are available to assist with questions and to provide mentorship to infection preventionist members. The frog poster is a clever way to remind staff to perform hand hygiene. This poster can be printed out and posted throughout your facility to remind staff to follow hand washing the frog way. Friction rubs out germs. Now your facilitator will stop the presentation to allow time to complete the post-test questions. This is a list of some resources that are available for your use, and additional resources that are available concerning the F-tags and antibiotic stewardship, Antibiogram, and the frog poster. That concludes the presentation. Now your facilitator will stop the slide presentation and ask if you have any questions.